Welcome, welcome. It is Wednesday night. I told Dr. Galvin it feels like it's midnight. It's so dark outside.
It is very dark.
But,
It is very dark.
well, North Carolina, but it's not cold yet here, though I'm seeing a lot of snow kind of coming around the places. Dr. Galvin and I were just talking. He's down in Boca Raton, and I said, my parents are down there. And when I told them I was working on this campaign, so today's session is sponsored or provided by MedIQ with support from Coveris. And I was telling my parents, I was like, this is going to be great. We're going to learn all these things. And my dad was kind of like, their later 70s, giving me the eye. And then I heard him answer the phone and he said, yeah, Adrian's here. Oh, she's here to see if we're slipping. So I was really tickled with that. So tonight I'm here with Dr. James Galvin and Dr. Jerry Amore, and really excited to have y'all here to talk about advocacy, your health, your voice, for those of us who are aging older already, which is really helpful. And we're thankful for that educational grant. So tonight's going to be a Q&A session. The three of us have met and talked. And so I would encourage people to submit your questions, and then we will try to get to them at the end. We have about 30 minutes. So really looking forward to that. I think our goal is to answer, and you all tell me if it's different, but I think our goal is to answer kind of common questions of children or older adults, and to say, how can we help their caregivers? How can we help their providers? Promoting a conversation on the importance of what to do when you go into a doctor's appointment, how to be ready, and really being a participant in your own care so that you can utilize your time wisely that you get with a physician like Dr. Galvin. So I feel like we're getting kind of the secrets, which I'm excited about. And both of you are fairly familiar with this topic and interacting with these people. So I think that's going to really help people learn how to prepare. Everybody introduce themselves. Dr. Galvin, you go first.
Sure. My name is Dr. James Galvin. I'm a neurologist, a professor of neurology at the University of Miami Miller School of Medicine. I'm located in Boca Raton, Florida.
Glad you're here.
Me too. My name is Jerry Amore, and I'm in Vermont, where it was dark at 5 o'clock this afternoon. I have many years working in healthcare as a risk professional, but I have recently become on the refocused stage of life, which means I don't get a salary or a paycheck or benefits anymore, but I'm still very busy. And when I stopped working, I said, I need to know what to do. And I live in a place where there's a lot of older people. And I realized that patients didn't really understand the system. So my passion now is helping patients learn how to get the most from the system. And that's what I do now.
Well, that's really helpful because I think when my parents go to the doctor, it's oftentimes after the fact that I'm like, oh, I should have ask this or write that down. Dr. Galvin, why is it important that you write down the questions? Because I think we're all like, we don't need to write down the questions. We'll remember them. But why is that important? Walk us through what the doctor is thinking when you see the patient in terms of kind of your list for the checkup.
Right. So I think it's important for the patients and or their family members to be prepared. And so most medical practices are very busy. You're usually one of many patients. Depending on the size of the practice, they may have multiple rooms, and there's patients in each room. There's patients in the waiting room. And so the doctor has to do certain things in order to drop a bill, right, for the services rendered, and so they could bill insurance. And so the statistics suggest that a person has about 30 seconds to get their chief complaint, the reason they're there, out for the doctor. And then the doctor has to start to do the things they need to do in order to complete, the visit and to make it a billable service. So if you don't go prepared, then it's really, really challenging. So what you should do is you think about the things that you want to talk to the doctor about. And this should focus on what's changed since the last time you saw the doctor and what new problems may have arisen that you've never talked to them about. And then prioritize those questions. So what are the most important questions, the ones you absolutely have to get out? And then the ones that, if you have time, you'll get to. And if you don't do that, then that 30 seconds is going to roll by, and they're going to start taking your vital signs and listening to your heart and your lungs and doing whatever else they're going to do, and then the visit's going to be over. And then the worst thing you can do, and I want to hear Jerry's thought about this, the worst thing you could do is at the end of the visit say, oh, by the way, because guess what, the doctor has no more time to spend with you. And it's not because they don't want to, it's because they can't. And so the worst thing to do is not come prepared and then try to slip that question at the end, because it ain't going to happen. Boy Scouts are be prepared. And I think as a patient and as a caregiver, you need to be prepared as well.
Yeah. So Jerry, what do you think about that, by the way?
I think Dr. Galvin is right on this. And he and I have talked about this. I live in a community of older people, and my spouse is significantly older than I am. And so when we moved here and I started talking to people about this, it became clear to me that we grew up in an era where Marcus Welby and Dr. Kildare, I had such a crush on Dr. Kildare, right? I mean, that was the model, that they had lots of time to give you and all the attention in the world. And, they were wonderful to look at to boot, right? It was just amazing what we believed. And now, when you become an older person and you're not in the workplace anymore, in the active workplace anymore, your view slows down because you don't have to deal with the hectic life that Dr. Galvin's dealing with right now. You don't have to worry about being here right now, doing this right now, all of this. And so your perception of time changes. So many of my friends, their perception of time has changed. They go into the doctor's office with a much slower pace. They figure the doctor has everything in the medical record and has read it already and remembers it to boot, right? And then they get in the car and remember the things they haven't told the doctor, and they're frustrated. So it's important to be prepared because the world is moving very quickly. Healthcare isn't what you remember from when you were a kid, and you need to come with everything organized in order to get the most from your appointment. Would you agree with me, Dr. Galvin?
Yes, and I think you want to have your list. You want to keep your list. Mm-hmm. I'll tell you a little secret. What you don't want to do is hand your list to the doctor.
No.
Because what's going to happen, they're going to take that list and say, we'll get to this later, and then they'll get back to doing what they were going to do. Right. So don't give your list to the doctor, but have your list. But right. You have to prioritize it, right? You can't come with the book because there's not time to go through a book. So key questions, prioritize. What do you absolutely need to talk to the doctor about? How have things changed? And what's new since the last time I saw you?
Yeah.
One piece of paper.
Yeah.
One piece of paper, one side.
Dr. Galvin, how do you feel about having your patients have maybe an adult child or a caregiver listen in on a phone or record a visit with you?
Well, in my circumstance, I will not see a patient by themselves. The patient has to come with someone. Okay. Because I, want to get an independent source of information about what's going on with the patient. And two, I focus on seeing older adults, many with memory problems. I don't think necessarily that that individual might be the most reliable historian, and two, remember everything that I said to them. So I think it's very important. It is a little out of practice. Most people are used to going to the doctors by themselves. But in the case of the older adult, I really do think that having a patient advocate along with you, so a child, a spouse, a sibling, someone who can advocate for you, and two, be a second source of information and a second listener to what's going on. Failures in doctor-patient communication originate from both sides. Some doctors are not great at delivering their messages to people, and people aren't really good at absorbing the information the doctor's giving them. And so that disconnect often leads to problems that potentially could be helped by having another person in the room.
That's so true.
Jerry, do you see that? Do these kind of older patients come back with more complaints after seeing the doctor?
You mean
And what can we
complaints
do?
about the doctor? Yeah.
Yeah.
Yeah, they come back and said, that doctor rushed me out of there, or they told me something that doesn't make any sense. What does this have to do with my eyes? Or what does this have to do with my throat? And not fully understanding what happened in the visit and then complaining about it afterwards. And so I found it happened by accident the first time, but I find myself explaining the healthcare system a lot. And explaining that I know it seems this way, but it's not this way. And I think that you're right, Dr. Galvin. If you bring someone with you to the doctor's office who hears it as well, but maybe is a little younger than you, or is different from you, or maybe even a helper, not even a relative, who can help you understand what happened in that visit, because so much happens in the visit. And by the way, this isn't a problem just of older people. You mentioned it yourself, Adrian. Any of us could go to the doctor and we get so much stuff thrown at us, we aren't going to remember. So it's a good idea to bring an extra set of ears with you.
Well, and I liked what you just said about trying to understand the system. I feel like even with myself, you have all these names and passwords and different hospitals and you're logging in. And it sounds like it's really important to not ask Dr. Galvin questions about the patient portal.
Yeah, no, don't ask him. I'm sure he knows, but he's too busy.
Right. So how do we need to encourage people to really work on that ahead of time, or have help with that ahead of time?
Have help with that ahead of time.
Because we can deliver information to you and you can ask us questions via the patient portal. So my physician assistant goes through my in-basket multiple times a day and takes care of things, right? But if people aren't using the patient portal and they want to use the old-fashioned way of, trying to call, and well, my number is not listed, right? My private back line, and the front line, gets answered by the receptionist, and she's very busy helping everybody else, and so it takes a really long time to get that message, to the back office. But the patient portal, when there's a message, we get a little ding. We know there's a message, and we can go and address it, either myself or my physician assistant, and we can address those things. Sometimes they're simple things like I need a refill. Sometimes they're more complex things that require, not just us typing back a message, but a phone call, to try to sort out the problem. But the patient portal, you have to learn how to do it. But once you learn how to do it, it can be really easy and facilitate communication.
Yep.
And I can check it from everywhere. I can check it from my phone, from my laptop, from my desktop, anywhere. Whereas, leaving a phone message, I might not get it until a day later.
Right. That's good to know. I mean, I still remember that when there was no portal. I'm 49. It's just everything's changing so quickly. What would you say to the older person who lives alone about how should they kind of keep up with their symptoms, what's happening, compared to someone with my parents, not to keep using them as an example, but my mother sort of monitors my dad too. So when you live alone and you're sort of in charge of yourself, and how do you go to see Dr. Galvin if you don't have a person? How does that all work?
Are you asking me that question?
Yes, I think so.
Okay. Yep. Okay. So, if you live alone, it's more difficult because you may not even notice your changes, right? And you may think you're still fine and you're not. And there's a big magical thinking that goes on, that we picture ourselves still at 30, even when we're in our late 70s or 80s or 90s. And so there's a little more difficulty. You're going to talk about a toolkit that MetaQ and Coveris are making available. But in addition, that little book you were showing that you picked up, your log, a journal is a nice thing to keep by your bed. And just like as you're winding down for the night, to write down the things that have happened that day, like, oh, I almost fell when I left the front porch, or whoa, I got really dizzy and had to sit down when I stood up. Those kind of things, just to keep a log of those, so that before you go to the doctor, you take the time to go back through and look at all of that stuff to say, ooh, what seems to be a pattern? What do I need to address? What do I need to talk to the doctor about? And that's for those of us who aren't yet where we need a caregiver proxy, but we're already getting to a place where we're slowing down a little bit. The other thing I want to say about the portal, if I may, because this plays right into this, is one of the things that I do with my spouse, who doesn't always notice things, is I have permission to be on the portal, on his portal. And so fortunately, he doesn't really type. So we get on the portal together and I say, Dr. So-and-so, this is Jerry. I am taking dictation from John, and then I let John dictate, right? And then I say, now I'm going to speak for me. This is what I see. Please get back to us. And that has worked on so many levels, so many times, because we see the situation differently and the doctor has a chance to get back to us. So that's also a thing. If a person can learn to use the portal, that's a really good thing.
Well, thank you. So, Dr. Galvin, when Jerry just mentioned the proxy, and a woman named Karen said, I'm taking care of my older mother and she's resistant to assistance. What advice, Dr. Galvin, do you give to kind of help someone prepare that person for a visit or get them in to come see you if they don't want to?
Right. So, obviously there's different strategies that are going to work with different people. One thing we don't want is you to be the sneak attack, right? Someone comes and they weren't told they were coming, they weren't told why they were coming. That usually doesn't lead to a very good doctor-patient relationship. But I think there are a couple of different strategies. There's the one, I'm concerned about you, I've noticed this, let's go to the doctor and check it out. There's two, I heard about this doctor who's going to help us do this. Why don't we both go and check this out? So, again, it'll vary from person to person. I think some people live alone. And so, but most people, there's some people who live alone and are alone. And that's more difficult because you can't really find a proxy. There are a lot of people that live alone but aren't necessarily alone, right? So they have a daughter who lives in another state, but they talk to them on the phone. They have a best friend who is, has known them for 30 years. So there's lots of places to find, proxies or advocates that can help you with the care. It just, sometimes it takes a little bit of time to find that person. But getting the resistant patient in, there'll be different strategies based on that person's, one, belief system, and two, personality.
So, yeah, I know about this. Jerry, I understand there are a lot of barriers to seeing a doctor, maybe depending on your type of illness. But what can we do to kind of overcome these barriers, and what do you see as the barriers?
Well, sometimes there is transportation barriers. Sometimes there are cost barriers, like medications are outrageously expensive in the United States, right? Mm-hmm. And sometimes there are barriers of emotional barriers, right? So what can we do to overcome them? Well, if you're the person, the patient, and you want to overcome these, one of the first things you can do is you can talk to your doctor about, especially medication or treatment barriers. Like, doc, you want me to go have this test, but I can't get there. Do you have any ideas? Now, in your community, also for transportation, there are things like, well, we have Aging Well here, but like the Area Agency on Aging or other organizations that will help people get places. You don't have to just take public transportation. So there's contact your agencies on aging. Let the doctor know that you need the help. If the doctor themselves can't really make that resource for you, many organizations that doctors work in have social workers and other people that can help you. So don't let the barrier be the barrier. Now, if it's a psychological barrier, it's okay to say to your doctor, this bothers me, this frightens me. I don't know if I can do this. To have that conversation about, can you tell me more about what you can do? Because leaving a doctor's visit and saying, yeah, 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 and then not doing it is not an option, because you come back, the doctor's made another appointment with you on the basis that you will have done something. And if you come back and none of that has happened, then you're still where you were before, or maybe worse. So, to people out there that are patients, please tell your doctor if you have a barrier, any kind.
Dr. Galvin, talk to me a little bit about mental health in older patients, because this has been kind of a topic around our house lately. And I realized it doesn't seem to be, there's a lot of talk about that. Is that accurate?
Well, the older adult is at a higher risk for a number of conditions. So, one, they're at a higher risk for depression. And so, there's a condition called geriatric depression or older adult depression. And that can be its own individual condition. And so, but depression is immensely treatable through a combination of psychotherapy and counseling, and if necessary, medications. The older adult is also at a higher risk for dementia, such as Alzheimer's disease, of which depression sometimes can be the first symptom. Um, and then older adults are also at a higher risk for senses of isolation and loneliness, because unfortunately, as they get older, maybe their circle of friends, didn't get old with them. And so they may feel a sense of loss or social isolation. And then the last, of course, is that older adults are at a higher risk for going through bereavement because they've lost their spouse or their significant other. And all of those things can lead to, a lowering of well-being and a sense of purpose and quality of life. So on top of the medical side of things, it really does change the way people approach life and their enjoyment of their activities. And again, being able to talk to the doctor is good. And some doctors will have more skills to have these conversations than others. Some doctors will have more time to talk about these things with others. But there are resources available. So I have a social worker in my office, but a lot of most doctors' offices don't. But they can make a referral to a social worker or a counselor or a psychologist. And developing a therapeutic alliance can often help a lot of these mental health issues that occur. If it's a dementia like Alzheimer's disease, the doctor can start the workup to determine what the cause is, and then come up with a treatment plan. So these are real issues, and a large proportion of older adults go through at least one of those four things that I mentioned.
Yeah.
And Dr. Galvin, why is it important not to just kind of say, you know what, we'll worry about that later. I can't help my mental health. I'm busy, or maybe I'm having a little memory issue, but I'll do that in another 6 months.
Yeah, well, we can always do something. It's never too early, it's never too late, but it's better to be too early than to be too late. So most of our therapeutic approaches are going to be most effective in the early stages of a condition rather than the late stages of a condition. So being proactive instead of reactive is really the way to go. We spent a lot of time as physicians talking about, disabilities and disablement and death and disease. We don't spend nearly as much time talking about health and vitality and capabilities. But if we can find a way of shifting conversations and talking more about health, I think we would be able to really turn the tables on some of these problems that all people, not just older adults, all people face as they try to manage their lives.
And Jerry, what makes the older people a more vulnerable population?
Well, when I hear the word vulnerable, I kind of go, we're not all at the same level. We're all a little vulnerable. And just as we get older and our thought processes slow down, it makes us not keep up with that fast world. Like we talked about in the beginning, the world is going very quickly and we're going a little bit slower. And maybe we're even losing some of our ability to think through things as quickly or as well as we used to. And that slowness and possibly depression and possibly dementia and possibly being on so many medications that they interact with each other. All those things make us less able to move at the pace, think at the pace, respond at the pace that we used to. And that slowness, the world doesn't wait. The world keeps going at its quick pace. And so things go by older people. And that creates a void, a place where I may not catch everything. So we need, in my mind, our older people are just like the rest of us, just moving in a slightly different lane on the highway than we are. And so if we can recognize that and get help, I think that that's important. Would you agree, Dr. Galvin?
Yeah, I mean, I think each patient's journey is their own unique journey, and so while there are some common themes, and we can think about in a broad sense of how to help people, each person's journey is a little bit different, and having a good therapeutic alliance with a healthcare provider can make all the difference in the world.
And Dr. Galvin, are there online options for people to find kind of information to help them in this same genre of conversation? Are there any resources you think our viewers need to know about?
Well, I mean, you can find anything online nowadays. You'd like to try to get some reputable referrals. So again, I'll just use my practice as an example. At the end of our visit, we actually take notes for the patient and give the patient that sheet with what we talked about on the front part of the page. On the back part of the page are recommended referrals, resources, websites, and other types of helpful hints. So again, it's all in one piece of paper. And while I know EHR prints out a whole bunch of stuff that most people don't know what to do with and just toss in the garbage, this page is really useful because it's exactly what I said to them, because my assistant's taking the notes for them. And two is on the back is, okay, here are, resources for mindfulness, for diet, for exercise, for cognitive activity. Here's the other clinicians I want you to see. Do you need physical therapy, occupational therapy, whatever that is? Here's information for caregivers. Here's information for the patients from patient organizations like the Alzheimer's Association, the American Parkinson's Disease Association, the Lewy Body Dementia Association. It's all there, their phone numbers, their websites. So it's ready-made resource for them. And that, I think, has really helped because they walk away not just what they heard, but they walk away with it written down for them. And for the families in particular, I think that's been a really useful resource.
I would think so. And there's one question that I don't want to ignore because I think this is a question that a lot of people have. And it's maybe for both of you. Jerry, you might even have an idea. Lori's saying, what can someone do if they suspect their spouse may be experiencing some dementia? What do you do?
What would I do first? I'd call
Yeah.
Dr. Galvin. What I would do is I would ask my spouse if they're noticing changes in their own behavior. Because at the early stages of dementia, often people are very frightened, I believe. I don't want to speak for you, but people I've known in early stages of dementia kind of know things aren't right and are pretty scared. And so the first thing I would do if my close person was behaving differently would be to say, are you aware you didn't turn on the coffee pot or you didn't put the water in the coffee pot last night like you usually do? Are you aware of that? What are you aware of? And how are you feeling? And see if they confabulate, if they make up stuff to cover, or if they kind of go, I'm kind of scared. And I've known people who will actually say, I'm kind of scared. And then why don't we go together and get baseline tests? Since we're both getting older, let's go see what's going on. Maybe we should go to see a doctor. And I've known that to work with several couples that I know. So I would take it from a place of caring and love and not a finger pointing. And I would take it from a place of, I'll go with you. I'll walk this journey with you so that people don't feel alone in the journey. That's my experience anyway.
And Dr. Galvin, do you find that once they're in to see you, they sort of are happy they're there?
Sometimes not. It depends. Again, depends on the circumstance by which they came to the office. It also depends on the person's personality and where they are on the, on the spectrum of their own insight. So unfortunately, diseases like Alzheimer's disease robs people of their insight. So about 50% of people really don't have any insight into the problem. So they fully recognize that things aren't going as well, but they don't perceive it to be their problem. They perceive it to be, the rest of the world's problem. But this is where I said about being prepared. So one, the I agree that having a conversation with your loved one is a great idea, and some of the strategies Jerry mentioned are great. But one, what are these problems? This is new. This is not my husband or my wife or my mother or my father or my grandmother the way they used to be. They're different now. So write that down, and that's going to be the gist of that conversation. With the first person is going to be your primary care provider, because that's the person who knows you the best. Yeah, you can skip the whole line and try to get to see a neurologist. You'll have to wait a while. But there's a lot of things the primary care doctor can do. Actually, there's almost everything that I do, a primary care doctor could do. And so having that list is really great. And the other is seek a reliable source of information. So if you want to find out more about Alzheimer's disease, the Alzheimer's Association is a great resource. They're designed for that. They have a 24-hour, 24/7, 365 helpline. So if you call, a social worker gets on and they will talk to you at any time of the day or night. But their website has lots of resources. They have a helpline. Many other organizations are very similar. And so you can find some resources so that you can educate yourself, so that you can be better prepared for how you can help your loved one and what part of the journey you are going to have to face, as you maybe transition from a partner to a care partner. And that's a role that takes people time to get used to, because it's a shift often in the relationship. But so you need to prepare yourself as well. And so there's lots of resources out there. And again, if you have a question about a disease, most diseases have advocate organizations that are there to help. So you can educate yourself. You can make your list, talk with your primary healthcare provider, hopefully start the workup. And if that requires a referral to a specialist, then get that referral and then follow through with that visit.
Oh, that's great advice. That's great. I think that leaves people just saying, okay, well, I know what to do first. I'm ready. Thank you all so much, Dr. Galvin, Jerry Amore, tonight, for sharing your expertise. And I appreciate all our folks listening and the folks that will be listening to this afterwards and still submitting their questions that no one will be there to answer. But you'll be able to go to those online resources. And we have a survey, which I think is awesome. And these surveys really help researchers know what kind of things do we need to help get information to people. And Caveris has sponsored this video tonight, and so I just think it's really awesome. And if you take the survey, 5 people will win a $100 gift card, which is always very popular with my followers.
And don't forget the toolkit, the how to prepare for a patient visit toolkit.
And the toolkit. So I will put the toolkit in the comments right after this so everybody can see it.
Okay. Thank you.
I'm going to print it all for myself.
Great. Thank you.
Thank you so much. All right. Thank you for having us. Okay.
Thank you.
Bye-bye.
Bye-bye.